Dear followers, warm greetings and welcome back to a new episode in psychopathology. Today I'm going to talk about hallucinations in different modalities. Hallucinations. Before classifying an experience as hallucinatory, other possible explanations must be considered, as not all perceptual distortions indicate pathology. The differential diagnosis of hallucination includes illusions, pseudo-hallucinations, hypnagogic and hypnopompic imagery, vivid mental images, and even normal perceptions. Some experiences may be delusional rather than hallucinatory, where a person believes others are talking about them without actually hearing voices. Auditory hallucinations. In 1900, Wernicke introduced the term phonemes to describe hallucinatory voices, though this term has fallen out of common usage. Auditory hallucinations can range from simple sounds, such as indistinct murmurs or ringing bells, to structured voices delivering clear messages. While elementary auditory hallucinations appear in organic conditions, complex auditory hallucinations are frequently associated with schizophrenia, often reinforcing persecutory delusions or delusions of control. Though voices are commonly observed in schizophrenia, they can also manifest in cases of delirium, dementia, or severe depression. Though in depression they tend to be fragmented rather than continuous, unlike those in schizophrenia. Hallucinatory voices vary in clarity. Some individuals identify specific speakers, while others struggle to pinpoint the origin or nature of the voice. Unlike everyday auditory experiences, patients are often unconcerned about the direction of the voice or the identity of the speaker. Certain hallucinations involve commands, termed imperative hallucinations, which may influence behavior. Some voices comment on the person's actions or discuss them in the third person, a characteristic that once was believed to be diagnostic of schizophrenia, but has also been noted in mania. Some patients hear their own thoughts spoken aloud, a phenomenon termed Gedankenverden, or thought sonorization, where thoughts are heard before or as they occur. A related concept, echo de la pensée, or thought echo, occurs when thoughts are heard after they arise. Thought broadcasting, where individuals believe their thoughts are accessible to others, is often classified as a thought disorder rather than a hallucination, though some definitions suggest audible thoughts precede broadcasting. Individuals may attribute voices to external sources such as witchcraft, telepathy, radio signals, or even originating from within their own bodies. Some report speech movements within their throat, feeling their own voice emerging independent of their thoughts. Studies reveal that subvocal lip and throat movements increase when experiencing auditory hallucinations, raising questions about the physiological basis of the experience. In some cases, patients deny hearing voices but assert that people are talking about them. Careful evaluation may reveal continuous hallucinations that are misattributed to real individuals, sometimes leading to hostile reactions toward perceived tormentors. For instance, a Greek woman in a psychiatric ward persistently attacked fellow patients, convinced they were speaking Greek, a language no one around her actually spoke. Visual hallucinations. Visual hallucinations can range from elementary flashes of light to complex images, including figures, animals, or objects. Some individuals experience scenic hallucinations, where full scenes unfold like a moving picture. In fact, scenic hallucinations are very common in some persons inflicted with delusional disorders, where their systematic delusions can contribute to a very complex scenic hallucinations. Although hallucinations are usually not common in delusional disorders, but this is observed. Visual hallucinations are often observed also in organic conditions, such as delirium, where small animals or insects are frequently perceived. Some cases involve exaggerated, bizarre imagery. For example, one patient described seeing mice carrying suitcases aboard a flight to Lourdes. These hallucinations often trigger intense fear, though some individuals find them amusing, as seen in Lilliputian hallucinations, where tiny people or objects evoke childlike pleasure. Unlike auditory hallucinations, visual hallucinations are rarely reported in schizophrenia, so their presence warrants a re-evaluation of the diagnosis. Some individuals describe visions, which often resemble pseudo-hallucinations rather than true hallucinations. A rare condition, Charles Bonnet syndrome, produces complex visual hallucinations in individuals with visual impairment without any underlying brain pathology. Olfactory hallucinations. Olfactory hallucinations may arise in schizophrenia, organic conditions, or depressive psychosis, but distinguishing them from illusions or delusions can be challenging. Some individuals believe they emit an odor, often interpreting others' reactions as proof rather than actually smelling it themselves. A subset of patients believe they smell poisonous gas, reinforcing paranoid delusions of external persecution. Temporal lobe disturbances sometimes feature olfactory auras, typically characterized by unpleasant odors such as burning rubber or paint. However, some olfactory hallucinations can be pleasurable, as in religious experiences where individuals smell roses near saints, termed the Padre Pio phenomenon. In Padre Pio phenomenon, the individuals reports smell of roses near saints or saints' shrines, etc. Gustatory hallucinations. Hallucinations of taste may occur in schizophrenia or organic conditions, though determining whether the sensation itself is abnormal or merely a delusional interpretation is challenging. Depressed individuals commonly report diminished taste perception, describing all food as bland or uniform. Tactile hallucinations. Tactile hallucinations can involve formication, the sensation of small creatures crawling on the body, which frequently appears in organic conditions or cocaine psychosis, known as the cocaine bug phenomenon. Some individuals experience sensations of heat, cold, electrical shocks, or even sexual stimuli, attributing these to external forces. According to Sims, tactile hallucinations can be divided into superficial hallucinations affecting only the skin, thermic, feeling cold or heat, haptic, sensations of touch, hygric, the feeling of fluid running through the body, Prosthetic, pins and needles, often with an organic origin. Kinesthetic hallucinations, affecting muscles and joints where limbs are perceived to be twisting or moving. Vestibular hallucinations, floating, sinking, or flying sensations, which commonly appear in delirium tremens or intoxication. Visceral hallucinations. Visceral hallucinations, classified by SIMS, involve internal pain or twisting sensations. Some individuals describe excruciating, bizarre bodily distortions, such as organs being removed or flesh being torn. One patient insisted his brain was being peeled layer by layer in a cosmic battle between good and evil. A particularly rare hallucination, delusional zoopathy, involves hallucinatory perception of animals moving inside the body. In one documented case, a patient claimed he felt an animal in his stomach. Autopsy revealed a thalamic tumor, providing an organic basis for his disease. The sense of presence. A felt presence is difficult to classify. It is not strictly a hallucination or a delusion, yet it involves a strong perception of unseen entity. Many people occasionally experience this sensation when alone in dark or in familiar places, typically dismissing it as imagination. Historical records describe profound presence experiences, such as Saint Teresa of Avila's account, where she felt Christ standing beside her, though she saw nothing with her physical or mental eyes. Some individuals with psychiatric conditions report persistent distressing feeling of being watched or followed, even while knowing no one is actually there. While a sense of presence is occasionally observed in healthy individuals, it may also manifest in schizophrenia, organic conditions, or dissociative disorders. That was a summary of different types of hallucinations across different modalities of sensations. Thank you for watching and listening, and see you again in a new future episode on psychopathology.